Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear GP talking to a patient called Mrs. Turner. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Mrs. Turner, come in, please. How are you feeling today?
Hi, Doctor. I'm not great, to be honest. I've been having this terrible pain in my stomach for a while now, and it just doesn't seem to go away. It's starting to really worry me.
I'm sorry to hear that. Let's go over your symptoms in detail. When did the pain start, and what does it feel like?
It's been a few weeks now. The pain comes and goes, but it's mostly this dull, gnawing feeling right in the middle of my abdomen. Sometimes it gets really sharp, especially after I eat or if I haven't eaten in a while. I've tried taking antacids, and they help for a little while, but the pain always comes back.
That sounds like it could be a peptic ulcer. Peptic ulcers are sores that develop in the lining of the stomach or the upper part of the small intestine. The fact that the pain worsens after eating or when your stomach is empty is quite typical of this condition. Do you feel any nausea, bloating, or notice a burning sensation?
Yes, exactly. I feel bloated most of the time, and there's this constant burning feeling in my stomach. Sometimes I even feel a bit nauseous, but I haven't actually thrown up. It's just this lingering discomfort.
Those are all common symptoms of a peptic ulcer. They're usually caused by an infection with a bacterium called Helicobacter pylori, or from the long-term use of non-steroidal anti-inflammatory drugs NSAIDs like ibuprofen, or aspirin. Have you been taking any of these medications frequently?
I have been taking ibuprofen more than usual for my back pain, actually. Could that really be causing this?
Yes, NSAIDs can damage the protective lining of the stomach and lead to the formation of ulcers. When the lining is weakened, stomach acid can irritate the tissue underneath, causing pain and discomfort. But don't worry, peptic ulcers are treatable. We'll run a few tests to confirm the diagnosis and identify the underlying cause. If it's related to Helicobacter pylori, we can treat the infection, and if it's due to NSAIDs, we can adjust your medications to prevent further irritation.
That's a relief to hear. What kind of tests do I need to take?
We'll start with a breath test or a stool test to check for Helicobacter pylori. If needed, we might also recommend an endoscopy, which allows us to look directly into your stomach and see the ulcer. It's a simple procedure where a thin tube with a camera is passed through your mouth into your stomach while you're sedated, so it's not painful.
An endoscopy sounds a bit intimidating, but I guess it's important to know what's going on.
I understand it might sound uncomfortable, but it's actually quite routine, and the results will help us determine the best treatment. Once we have a clear diagnosis, we can tailor your treatment plan. In most cases, we'll prescribe medications to reduce stomach acid and, if necessary, antibiotics to clear up any infection.
How long would the treatment take? Will I have to change my diet too?
Treatment usually lasts a few weeks, depending on the severity of the ulcer. will prescribe proton pump inhibitors PPIs or H2 blockers, which reduce the amount of acid your stomach produces, giving the ulcer a chance to heal. If Helicobacter pylori is the cause, a course of antibiotics will be included as well. As for your diet, we'll recommend some changes to help manage your symptoms and prevent further irritation. Avoiding spicy foods, alcohol, caffeine, and acidic foods like tomatoes or citrus can reduce discomfort while your stomach heals.
I've already cut back on spicy foods, but I didn't know things like caffeine could make it worse. I guess I'll have to say goodbye to my morning coffee for a while.
Yes, unfortunately, caffeine can increase stomach acid production and worsen symptoms, but it's just temporary while we work on healing the ulcer. You might also want to avoid smoking if you do, as it can slow down the healing process.
I don't smoke, luckily. But what happens if the ulcer doesn't heal? Are there complications I should be worried about?
Most peptic ulcers heal with a proper treatment, but if left untreated, there can be complications. These include bleeding, which can occur if the ulcer erodes a blood vessel or perforation, where the ulcer creates a hole in the stomach or intestinal wall. Another possible complication is gastric outlet obstruction, which can happen if the ulcer blocks food from passing through the digestive tract. However, these complications are rare, especially if we catch it early and treat it properly.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Collins. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Collins. I'm Dr. Sarah O'Neill. What brings you in today?
Hi, doctor. I've been feeling really off for the past few months. I'm always tired, like all the time, no matter how much I sleep. I get dizzy sometimes too, and even simple things like walking upstairs leave me out of breath.
That sounds concerning. Let's try to get to the bottom of it. Has anything changed recently, like your diet or lifestyle? Have you experienced any other symptoms besides fatigue and shortness of breath?
Well, now that you mention it, I've noticed my skin is paler than usual, and I've been getting headaches more often. As for my diet, I guess I haven't been eating as well as I used to. My job's been hectic, so I'm skipping meals or just grabbing whatever's quick.
Fatigue, dizziness, shortness of breath, pale skin, and headaches could be signs of anemia. You mentioned your diet has changed. Sometimes vitamin deficiencies can lead to anemia, particularly deficiencies in vitamins like B12 or folate. Are you familiar with vitamin deficiency anemia?
Not really. I've heard of anemia but didn't know vitamins had anything to do with it.
Vitamin deficiency. Anemia happens when your body doesn't have enough of certain vitamins it needs to produce red blood cells. Without enough healthy red blood cells, your body can't get the oxygen it needs, which leads to the fatigue and other symptoms you're experiencing. In many cases, it's due to a lack of B12 or folate, which are essential for red blood cell production.
Oh, that makes sense. I guess I haven't been eating as many fruits and vegetables lately, and I've cut back on meat too.
Those are key sources of B12 and folate. Meat, dairy, and eggs provide B12, while folate is found in green leafy vegetables, beans, and fortified cereals. A deficiency in either of these can cause your symptoms. Have you had any issues with digestion? Conditions like celiac disease or Crohn's can make it harder for your body to absorb these vitamins.
No, I don't think I've had any digestive problems, but I do take some over-the-counter antacids regularly for heartburn. Could that be related?
That could be a contributing factor. Long-term use of antacids can affect your stomach's ability to absorb B12. Your stomach needs acid to absorb this vitamin properly, and if you've been taking antacids regularly, it could be reducing the amount of B12 you're able to get from your food.
Wow, I had no idea. So what can I do to fix this?
The first step is confirming the diagnosis. I'll order some blood tests, including a complete blood count CBC, and tests to measure your B12 and folate levels. If the results show vitamin deficiency anemia, we can work on getting your levels back up. Treatment usually involves dietary changes, and in more severe cases, vitamin supplements or even injections.
Injections? That sounds serious.
Injections are typically used if oral supplements don't work, or if your body has trouble absorbing vitamins through your digestive system. But in many cases, dietary adjustments and supplements are enough. For example, we might recommend adding more B12-rich foods to your diet, like meat and dairy, or folate-rich foods like spinach and lentils.
I see. So it's not something I'll have to deal with forever?
In most cases, no. Once your vitamin levels return to normal and you maintain a balanced diet, the anemia should resolve. However, it's important to follow up regularly to ensure that your body continues to get what it needs. Some people, especially older adults or those with certain medical conditions, may need ongoing supplements to prevent a recurrence.
Okay, that sounds manageable. I guess I should pay more attention to what I eat.
It's definitely something to consider. A balanced diet can go a long way in preventing vitamin deficiencies. In the meantime, we'll wait for the blood test results to confirm whether this is the cause. If it turns out to be vitamin deficiency anemia, we'll get you started on a treatment plan right away. It's good that you came in when you did. Anemia can become more serious if left untreated.
Yeah, I'm glad I came in too. I was starting to worry something more serious was going on.
It's always best to check in when you're feeling unwell. Anemia, especially from vitamin deficiencies, is treatable, but it's important to catch it early. I'll follow up with you as soon as the test results are in and we'll take it from there.
Thank you, Doctor. I appreciate it.
You're welcome, Mr. Collins. We'll get you feeling better soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 medical professionals' discussion. Now read the question.
Have you heard about the new focus on nutrition and lifestyle advice in our dental practice guidelines?
Yes, I was just discussing it with another colleague. It seems to cover a lot of ground. There's advice on healthy eating, managing stress, and general lifestyle changes.
Yes, I suppose that's true, and I think it places a lot of emphasis on the nutrition part, don't you?
I'm not sure. I mean, yes, there's a significant amount of content about nutrition, but it makes sense. We're not just dealing with teeth. We have to think about the whole body's impact on oral health. Things like diet and lifestyle are directly linked to problems like cavities and gum disease, so it's important to address them thoroughly.
That's true, but I wonder if the balance is right. It just feels like a lot for us to manage alongside everything else.
Now look at question 26. You hear a medical professional explaining about blood-borne pathogens. Now read the question. While many of you have previously completed this training, it's important that we revisit it, especially now. The first part is ensuring that all staff are adhering to the standard precautions, including the proper use of personal protective equipment like gloves, gowns, masks, and face shields when dealing with blood or body fluids. Be sure to familiarize yourself with these protocols after this meeting. Also, remember to safely handle and dispose of sharp objects to minimize accidental exposure. Finally, if an exposure occurs, ensure you follow the post-exposure protocols, which include immediate washing of the area, reporting the incident, and receiving appropriate post-exposure treatment as guided by the department. Are there any questions? Now look at question 27. You hear a trainer giving training session. Now read the question.
Hello everyone and welcome to this training on managing, documenting, and responding to adverse drug reactions. First, let's take a look at the main objectives of this course. By the end of the course, you will be able to identify adverse reactions from medications and document them accurately in patient records. Additionally, you will learn how to set up a system for reporting these reactions both within your organization and to external regulatory bodies. Next, we will work through case studies so that you will be able to demonstrate how to respond to adverse reactions in real-life clinical settings and ensure patient safety. We will also cover how to distinguish mild from severe reactions and provide appropriate responses. Our final set of objectives focuses on how to implement long-term monitoring to prevent future adverse drug reactions.
Now look at question 28. You hear two healthcare professionals discussing a training session on supporting patients with eating disorders. Now read the question.
It seems that only about 35% of the staff have completed the training on how to support patients with anorexia and bulimia so far.
Less than half, but it's crucial that everyone completes the training by the end of next week. Should we send out another email reminder?
We've already sent 2 email reminders, and I personally spoke to some team members about it. I think we should bring it up in the staff briefing on Monday morning.
That's a good idea. Will everyone be able to attend?
They should, but if anyone isn't available, we can discuss it with them directly one-on-one.
Now look at question 29. You hear a trainee doctor talking to a senior doctor. Now read the question.
Dr. Smith, may I ask you a question about the antibiotic choice for this patient with suspected bacterial pneumonia?
Of course. What do we know about the case?
The patient is presenting with a cough, fever, and shortness of breath. Based on the symptoms and history, I suspect it could be community-acquired pneumonia. I was reviewing different antibiotics and noticed there are many options available. I'm wondering which one is most appropriate in this scenario.
Good question. The key here is to first consider the likely pathogen. For community-acquired pneumonia in an otherwise healthy adult, Streptococcus pneumoniae is the most common bacterial cause, but we also have to consider other pathogens like Mycoplasma pneumoniae. So, typically, we would start with a broad-spectrum antibiotic, such as amoxicillin or a macrolide like azithromycin, especially if we are unsure about the specific pathogen. The choice will narrow as we gather more data, including sputum cultures, to target the specific bacteria.
So the initial antibiotic choice is broad spectrum to cover common pathogens?
Exactly. And once we identify the pathogen more definitively, we can adjust the treatment to be more specific.
Now look at question 30. You hear two hospital managers talking about a recent training session for volunteers. Now read the question.
training activities went.
Well, we had a decent turnout, which was good. We asked a lot from the volunteers. On top of their usual tasks of helping out patients, they had to come up with solutions to case studies and participate in the group discussions.
Yes, that clinic approach we tried, where they solved real-life volunteer scenarios, seemed to keep everyone engaged. I'm just not sure if we focused enough on practical skills. Things like how to handle patient confidentiality or time management. Maybe we leaned too heavily on the creative side of things.
I see what you mean. That's something we should reconsider before we plan the next training session.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a presentation by a breast cancer nurse specialist named Emily Grant. You now have 90 seconds to read questions.
My name is Emily Grant, and I'm a specialist breast cancer nurse, supporting patients as they navigate the difficult process of being diagnosed and treated for breast cancer. Today, I'd like to share a typical case to highlight what my role entails. Let's focus on one patient in particular, whom I'll call Laura, to demonstrate the various challenges and support mechanisms that come into play when dealing with breast cancer. Before I tell you more about Laura's journey, let me give you some context. Breast cancer remains the most common cancer among women globally. In the UK alone, around 55,000 women are diagnosed annually. Early detection through screening, such as mammograms, plays a key role in improving outcomes. Unfortunately, for many women, receiving a diagnosis can be overwhelming, not just physically but also emotionally, as they struggle to process the information and decisions required. Laura's story began when she went for her routine mammogram at the age of 49. She had always been diligent about her health and had no immediate concerns, but during this appointment a small suspicious area was found. Laura was asked to undergo additional testing, including an ultrasound and a biopsy. Like many women, Laura was shocked because she had no family history of breast cancer and had never experienced any warning signs. When Laura was informed that she had early-stage invasive lobular carcinoma, she felt devastated, although the consultant provided clear explanations of her treatment options. Laura found it hard to come to terms with her diagnosis. She later confided in me that her greatest fear was not the cancer itself, but the changes it might bring to her appearance and overall health, particularly the possibility of losing her hair and feeling exhausted. As a nurse, my role is to offer both practical advice and emotional support. Many patients, like Laura, feel isolated, even when they have a strong support system at home. In Laura's case, she felt burdened by trying to stay strong for her family while concealing her own fears. I encouraged her to join a local breast cancer support group, where she met others going through similar experiences. Laura's treatment plan included surgery followed by chemotherapy. She underwent a mastectomy, which, while successful in removing the tumor, was a difficult emotional experience for her. Many women struggle with body image after such procedures, and Laura was no different. She was also apprehensive about chemotherapy, fearing the physical toll it would take. In our discussions, we talked about managing side effects like fatigue and nausea, and I provided her with tips on maintaining her well-being during this phase. Throughout the chemotherapy sessions, Laura experienced several of the common side effects, including hair loss and extreme tiredness, but she remained resilient with the support of her healthcare team. One of the things I emphasize to patients is that while the side effects can be difficult, they are temporary, and the goal is always to return to a cancer-free life. After finishing her treatment, Laura was relieved but also uncertain about what lay ahead. It's common for patients to feel a sense of emptiness after treatment ends because the routine that has structured their lives suddenly disappears. Laura expressed concern about the possibility of cancer recurrence and struggled to adjust to life after treatment. That's where our follow-up care comes in. We offer regular checkups for patients like Laura and refer them to counseling and rehabilitation programs when needed. Laura found great benefit in attending counseling sessions, where she learned to cope with her fears and rebuild her confidence. Additionally, she joined a rehabilitation program to help regain her physical strength and improve her body image. Laura's journey shows that breast cancer is not just about the physical treatment, it's about addressing the emotional and psychological impacts as well. With survival rates improving, it's essential to provide comprehensive care that supports both the mind and body.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Eric Johansson discussing bioprinting. Now, read the questions. You now have 90 seconds to read questions.
Welcome, Dr. Eric Johansson, and thank you for joining us today. We've been hearing a lot about bioprinting in recent years. Can you explain what it is and why it's generating so much excitement in the medical community?
Thank you for having me. Bioprinting is indeed an exciting field. It involves using 3D printing technology to create living tissues using bioinks, which are made from living cells. The ultimate goal is to one day create organs for transplantation, which could solve the critical issue of organ shortages. Right now, thousands of patients are waiting for organs, and many of them don't survive long enough to receive one. With bioprinting, we could theoretically print tissues or even organs on demand, potentially saving countless lives.
That sounds incredible. How exactly does bioprinting work? And how close are we to creating fully functional organs?
The process starts by layering bioinks to build up tissue structures. These bioinks are deposited in precise patterns to form the architecture of the desired tissue. So far, we've had success with simpler tissues like skin and cartilage. However, creating more complex organs, like hearts or kidneys, presents a huge challenge, mainly because of vascularization. This is the process of creating blood vessels that supply nutrients to the tissue. Without a network of vessels, larger tissues or organs can't survive. We're making strides, but we're still several years away from being able to bioprint fully functional organs ready for transplantation.
What are some current applications of bioprinting that are already showing promise?
One of the most promising applications is in wound healing, particularly for burn victims. Traditional skin grafts can be problematic, but bioprinting could allow us to print new skin using the patient's own cells, reducing the risk of rejection and speeding up recovery. Research is moving quickly in this area, and we're already seeing positive results in early trials. Additionally, we're starting to see bioprinting used to create bone and cartilage, which could transform orthopedic surgery. Surgeons might soon have the ability to print custom bone grafts that fit the patient's unique anatomy, reducing complications and improving recovery times.
That's amazing. But what about fully functional organs, like hearts or kidneys? How far away are we from that?
That's the ultimate goal. But creating fully functional organs is much more complicated. It's not just about printing the organ's shape. We also need to recreate its internal structures, including the vascular networks, nerves, and multiple layers of tissue. Researchers are working on solving these issues, and while it's possible that we could print an organ in the near future, it will take time before they're safe and reliable enough for widespread use in clinical settings.
There's a lot of optimism, but are there any ethical concerns that come with bioprinting?
Absolutely, and these concerns are critical to address as we move forward. Access is one of the biggest questions. Will bioprinted organs be available to everyone, or only to those who can afford them? We also have to consider regulation and safety. Bioprinted organs need to be thoroughly tested to ensure they're safe and won't introduce new risks. Then there's the question of long-term performance. Will these organs function as well as donor organs? It's essential that we find ways to make this technology available to all patients while ensuring it meets the highest safety standards.
So, to sum up, bioprinting could revolutionize healthcare, but there's still a long road ahead.
Exactly. Bioprinting has enormous potential to transform medicine. From skin and bone to potentially entire organs, the possibilities are incredible. But as with any breakthrough technology, it requires more research, funding, and careful consideration of the ethical issues before it can be widely used. We're making progress, but we still have a way to go.
That is the end of Part C. You now have 2 minutes to check your answers.